Hey, good morning. It's Patricia Murphy. It's Thursday. This is Seattle Now. A lot of people are unmasking, and COVID cases around here are going up. Living with COVID is becoming more of a reality and less of an emergency. Epidemiologist Judith Malmgren says it's okay to live your life. We'll check in with her right after we get you caught up. State health officials say COVID cases are ticking up slightly, but they're not so worried about that.
The need to count every case is not realistic, nor is it going to be as useful as it was in the past. What's more important is our deaths. I mean, we had less than 6 deaths today. That is just territory we have not been in a long time.
State epidemiologist Scott Lindquist says hospitalizations and deaths are both trending down, and the Omicron wave is in the rearview mirror. Officials echoed the recommendation to keep masking up in public, even if it's not required. In other news, Seattle-based real estate company Redfin confirmed what many renters already knew. A new report yesterday shows the median monthly asking rent in the metro area is up over a year ago by almost 29%. That's higher than the national average of 17%. Portland saw the biggest increase anywhere in the country, 40%. The Milwaukee and Kansas City areas were the only spots to see prices go down. And that slight uptick in COVID cases we mentioned is hitting the Mariners. Manager Scott Service, third base coach Manny Acta, and pitcher Paul Sewald have tested positive. They're isolating and will need negative tests in order to come back. Service said earlier this week that other M's staff had recently tested positive too. ESPN says Seattle was one of 6 teams that didn't hit the 85% vaccinated mark last season. COVID cases are ticking up again in King County, 17% over the past week. That's not too steep compared to past movement, but the week before, it was almost 40%. Overall, we're still in a better state than almost any other point in the pandemic. We wanted to check in with where we are with COVID and just how we should think about the increase in cases. Judith Malmgren is here to give us some perspective on where things stand. She's a Seattle-based epidemiologist. Judith, great to have you back.
It's great to be back.
So let's talk a little bit about the rise in cases. It's pretty small, but still an increase. How should we think about this?
Well, it's kind of where we are. I think we're not like getting alarmed. We're not freaking out. We're not sad. We're not mad. We're not happy. But we got to go into this neutral zone and just keep chill about the whole thing because it's part of our life.
This is a big switch I'm hearing from you, Judith, because we've been talking during this entire pandemic, and you have been extremely cautious.
Yes.
Tell me about your change in thinking.
We kind of have to look at the numbers. We do have still considered a low rate of COVID infection in King County. I mean, relatively speaking, we're a good mitigation state. I was over near the university recently, and a lot of the students walking around just outside, they're wearing their masks. Mm-hmm. Some people are asymptomatic. In Shanghai, out of 25,000 tested, only 1,000 were symptomatic.
Wow.
That's in a lockdown situation. Also, I don't know exactly how accurate that information is, but a lot of people do test positive, have no symptoms. A lot of people have like a small headache or something. And then you have other people who
totally whacked. I have friends who were totally whacked by this, Judith.
Yeah, there's such a large variance in the manifestation of the illness between people. It's a little unpredictable.
Yeah. Like we just talked about, we're a very masky city.
Mm-hmm.
Do you think, though, that this rise could be connected to the mask mandate going away?
Absolutely.
Yeah.
When Jeff Duchin was on air and he talked about taking the masks off, the general consensus was we're vaccinated enough and we're also, so many people have been infected that we would see an uptick, but maybe not a big one.
Sure.
I mean, at the gym, you can wear your mask or not wear your mask. A lot of people still do. At the symphony and at the opera, it is vaccine card and mask the whole time. Some restaurants, you have to show your vaccine card still. But then you sit around a whole bunch of people with their masks off. So I don't know. I mean, if there's that many people who are asymptomatic who have it, you can figure if you go into a large group of people, there's going to be some COVID.
Yes.
Like if you go to a rave, Patricia, like you do, as one does, there's like these dance parties, I think, down in SoFi. I don't even know what that neighborhood is. There's these impromptu dance parties, and don't ask me how it's Facebook. That's how I know, because I'm not of that age. But anyway, there's these big dance parties, and they like show up at 10 and dance till 2 or something like that.
Sounds fun.
They probably aren't checking vaccine cards, and nobody's wearing a mask. I think we've got it all going on right now.
Yeah.
I mean, we all just came out of a cave.
Well, let's talk about testing, though, because the landscape has really changed. You know, we all have tests at home now, at least most people do.
Yeah.
What does this mean for the pandemic response? Because it seems like if we're testing at home, we're not getting those numbers anywhere until we're hospitalized.
Yeah, if we check our white educated bias at the door, this is such an economic divide with who's got access to home testing. If you had a computer and you knew how to log in and how to request them, if you had them from the store, if you had $12 to buy them and they were at one point $24, then in all those cases, you have testing kits at home. So you've been testing at home, so we don't know what the incident number of cases are. We do know what the outcomes are. Unfortunately, hospitalizations and deaths lag behind. And here's the kicker. The government removed their support for PCR tests. So if you go get a PCR test, if you want one or need one, it's $150. And if you have insurance, it's covered. If you don't, it's not. So I think that's a little bit of a difficult situation, but they're not testing as many people.
You know, it makes me wonder, though, if the government should be continuing to provide tests to people.
I mean, if we're going to reach all sectors of our society, at least in King County, we can't make the assumption that people have money to pay for anything because Seattle's so expensive. You know, it's hard to buy groceries. So, I mean, if we just think about that a little bit, how are people with lesser means able to pay for something that, I mean, they may or may not know if they're sick. They may or may not care. The other thing, we're not doing contact tracing anymore. That's done. I think the posting frequency on the King County website has been diminished. So are we caring about the same things that we cared about before?
Yeah. I think that's a really valid question, right? I think maybe the answer is no. We are not measuring things the same way. You know, I wonder if we're at a point where COVID, you know, has become endemic. And while people are still getting it, it is just not disrupting our lives.
It is possible, but that's the thing that you can see in hindsight. We can't see going in. You know, going forward, you can't see what's one step ahead. Are we going to get a big spike or is it going to stay kind of low?
Are we going to get a new variant?
Yeah, you know, I think the newer variants seem like they're all the milder forms. You know, maybe COVID's getting tired of us.
Wouldn't that be fun?
Wouldn't that be nice? Yeah, maybe COVID's just kind of like, I've had it with these humans.
Okay, so we shouldn't really be worried about a new variant, I'm hearing from you.
Well, I'm not going to worry about a new variant because I spent a lot of time worrying the last 2 years and I'm kind of done with worrying about it. If it happens, we coped before. It wasn't pretty and it was kind of a mess. But if it happens again, we'll just, you know, it's the United States of America. It's a democracy. So we kind of deal with whatever rises to the top of the crisis measures at that moment. And then we move on. And then we forget about it. Then we're thinking about, you know, somebody getting slapped at the Oscars, or we're on to thinking about, well, I think this week is actually kind of quiet. I don't think anybody's had anything terrible. Then we might be looking at puppy videos. I don't know.
All right, Judith, before I let you go, you know, for more than 2 years, we have been balancing the risk of getting COVID against the risks of staying home, right? And we have learned about the real costs of isolation for kids being out of school and people isolating in their homes with no contact. How do you think people should think about the choice to stay home or go out today?
Well, that's a really tough question. I'm spending more time out. I'm seeking out friends I haven't seen because I think if I don't, I'll lose my mind. I just crave normality. I crave just being able to go out and not think about the mask, not worrying about it. But I'm still cognizant of it, not just for me, but for people that I'm around. There's also people who are continuing to isolate that have just kind of lost their connections because it's been such a long time. And I know that they are suffering emotionally and psychologically. I don't know really what to say because you have to assess your own risk tolerance. And that's what a lot of this is about, is risk tolerance. So do you feel like you are vaccinated and boosted enough? And if you wear a mask and you go out or you have to take a mask off, are you going to be okay? Some people that live alone, I think it's very challenging because the concern that they may get sick and who's going to take care of them or how are they going to cope is real.
Yeah.
So going forward, I think with telehealth, and if the community clinics are geared up and we have ways that people can be talked through illness, then I think we'll be okay. But I think that's kind of what we've learned from the epidemic is that telehealth is a great tool. I had COVID in February and I did telehealth with my asthma doctor. And, he could kind of listen to me as I talked and, talk to me about my breathing, how am I doing? And so I didn't ever have to go in and they didn't want to see me anyway because I had COVID. That helped me enormously. And it also gave me the confidence to be able to stay home and that I was okay and what to look out for.
Judith, really appreciate your time.
Oh, you're always welcome.
Great to talk to you. Judith Malmgren, Seattle-based epidemiologist. Have a good one.
Thank you.
Thanks for listening. Clare McGrane produced today's show. Matt Jorgensen does our theme music. I'm Patricia Murphy. See you tomorrow.